Hey guys, I'm here at Therapy Works in Star Valley. It's a therapy practice owned by Boone Hodges, and Dr. Alex Sharman works with them. But they have a new building here, a new clinic, and they've got a couple of cool gadgets in here. So I thought I'd bring you down here and talk to Dr. Sharman about what it means to be a physical therapist, but also to show you this anti-gravity machine and this cool rotating rock climbing wall and some of the other stuff they have in there. So hope you enjoy the field trip. We'll go inside. All right, Dr. Sharman, right?
Yep.
Tell us how you got into physical therapy.
So I wanted to a profession in the medical field. I looked at all kinds of stuff, even thought about optometry for a little bit. But the thing that really drew me to physical therapy is the amount of time that I can spend with my patients and really get to know them. And I'm a runner, and I've been a runner through high school, and so I always enjoyed being active and exercise, and so this just seemed like right up my alley. And so even in high school, like I would watch people run and stuff and like try to figure out, hey, you hurt yourself there, maybe try to do this, and they never listened to me. And then I called them up later, I'm like, hey, now I'm a PT, you can listen again?
So what do physical therapists do?
So we help people get back to what they love doing, getting back to their jobs. So post-surgical, if they're injured, or even an injury in recreational sports or things like that, we'll help them to get back to that. There's a wide, diverse field of physical therapy. So I'm an orthopedic physical therapist, but there's neuro, there's cardiopulmonary, there is integumentary, where they look at the skin. Mm-hmm. So all of that is part of physical therapy.
So someone goes to a special doctor because they got hurt or injured, they get treated or fixed for the most part, but they still have to recover. So they recommend them to you, and you help them keep their recovery going.
Yeah, for example, if they had an ACL injury or something like that in sports, and they have to have the surgery for the ACL reconstruction, but then they have to get back to whatever they're doing, they have to go back to life. So it's like being able to give them exercises, stretches, being able to get their knee to where it needs to be slowly, and we know how to do that. We know all the muscles, we know the anatomy, we know how to fix things and get them where they need to be. So.
Cool.
Yep.
How much college do you have to go to for physical therapy?
So 4-year degree, bachelor's degree is required to get into physical therapy school. So once you graduate that, you can apply for grad school, and then you go to physical therapy school for about 3 years. And then I did an extra year just for fun. So I did 8 years. So I did what's called a postgraduate residency program in orthopedics, so I could just specialize in orthopedics itself. So I did that in Nebraska. Great.
Cool. Awesome. All right. Well, we're going to have him show us some cool things like this anti-gravity machine, anti-gravity treadmill, and some other gadgets and things they have in here to help people recover. They have a Freedom Climber, which is a rock wall, but it spins, it rotates, and we'll have him show us that and stuff like that. And we might have him stick a needle in my leg because I'm getting therapy because I hurt my calf. So I might show you that, but I might not.
Depends on your face.
That's right. So he's needling my calf. Sorry.
You got it?
I think so. Yeah, there we go.
Yeah, so we're just placing needles. Dry needling is a technique that therapists are doing now. You can put needles into the muscle to release some of that tension. Works similar to like a deep massage, but just a faster release. So kind of a cool technique. Joe's loving it right now, right?
Yeah. My calf is twitching. All right, tell me about this machine.
Okay, so the Alter G is it's an anti-gravity treadmill. So if you want to show them your cool shorts there. So
see my cool shorts?
So
with
the
this
shorts
skirt
has a zipper on it, and then you zip it into the top here, and we'll show you that. And then this blows up with air, and what it does, it allows you to unweight up to 80% of your body weight.
So there's a chamber that just lifts me, kind of,
yeah,
lifts my body weight off the ground.
Yeah, and allows you to unweight. So really awesome for post-injury runners or anybody post-surgical can get in here, and we can get them walking, moving faster than they would normally. So a cool thing about that is, you know, you build up a scar tissue if you aren't moving on it. And so we allow you to get in here, move it, and it feels normal, natural, but you're only like 20% of pressure, so it doesn't hurt. So it doesn't build up that scar tissue as much as it could. So pretty awesome. And for runners, like say you hurt your Achilles or something, you're out, you can get in here and run on it pretty early on in that recovery. So.
Cool.
Okay, hop in, man.
Okay, I'll hand the camera to you. You can show them my cool shorts. See these? The Ultra G. And I just zip this in.
Yep, so go ahead and pull that up.
This up.
Yep. So you want this bar to be about kind of that bone on your hip side.
Okay, right there.
Right, kind of where, I would go maybe a little lower, right there. That's good, yep.
And what?
And then lock it. There you go.
And I just zip this in.
Yep. Do you need me to help you?
Maybe. Where's it start?
So it's just right here.
Oh, I see.
Yep. You might have to move around to get it to zip.
Here, you zip it and I'll hold it. So you can see this is zipping and it's creating a seal to this air chamber. And the air chamber goes down the sides. And then the air will...
So let's start session here. It's going to calibrate, so sit still.
Filling up with air. It's getting all puffy around me. In the back too. There it goes. It's really puffing up now. Now you can see it. And I can feel it lifting me off the ground. So it's lifting me in the air. I'm up on my tiptoes right now. Then it'll see how much I weigh, basically. Right?
Yep.
So
it's calibrating as soon as your weight's
it's all bulged up pretty high. You can see it all filled with air down there. I don't know if you can see my toes down in there. Yeah, I'm up on I can get off my toes even. I'm just, oh, there, it's deflating a little bit now.
So now it's all calibrated. So we can bring it in. And the cool thing about this, as opposed to like a quad therapy, is we can bring you like by percentage, you know, like we can go very, very specific. So we want to get you to 30% of your body weight.
So it's really puffed up now. The lower the percentage, the more air comes in here. So you can see me walking, but I'm just barely on my tiptoes. So he put the speed of the treadmill on there so I can walk and move my feet, and put a little bit of weight down. But if I'm not this seriously injured, but if I was really seriously injured, then it would help out. It's just all squeezed around here. Get a further out shot.
Yeah. So you can see he's barely walking on his toes. It's got him up in the air. How's it feeling? Doesn't hurt your calf, right?
What do you want?
And the cool thing is it has pressure sensors in it, so we can kind of see how much your weight bearing on one side versus the other side. So if someone's really injured, you want to get them to be equal. You can look at their cadence, you can look at stance time, step length. And then another thing is you can have a video camera on it.
There you go, you can see my feet walking.
So that allows someone who might not have that sense of where they are in space or figuring out how their feet are placing on there, you can get them to watch it. That visual feedback is really good.
Cool.
Okay. What do you want to do? Go faster?
Go a little bit. Well, I don't know. I'm nervous about hurting my calf. Go down. Raise that maybe. So I can get down on my feet. And then speed it up slightly. So you can see that my feet flattened out. I'm not on my tiptoes anymore.
20 miles per hour. 20-minute miles.
This is how fast I do my ultra marathons. Basically.
Really?
So, sometimes, yeah. Climbing up and down mountains.
But this is at times.
Yeah.
Not your overall.
Yeah. All right, that's the Alter G. So we'll go to a new machine next. Tell us about the Freedom Climber and what it does, like its functions and stuff.
So the Freedom Climber is just a cool rock climbing wall that we got here. It's not, we don't have it specifically for any specific person, but it's really, we like it for kids or people who are more active or things like that. They can get on here. Say someone injured their wrist or hand or forearm or something, and they need to get back to climbing ladders, things like that. They can do this. It's fun. It's functional. But the cool thing about this wall, so it rotates, so you're always climbing. So you can just always be climbing. If you go toward the middle, you stop it, but if you go toward the side, you can keep going. And then you can change the resistance on it. So right now it's kind of on a slower resistance because I don't know if I can do it faster than this.
So you could just climb indefinitely while it turns.
You can climb and you can go to the other side. You can climb that way. But I mean, the whole thing that's really cool about this is it works my hands, my arms, my feet, works my legs, core, everything. Makes me tired. And then you can change the resistance. So that was on a pretty like slow resistance, but you can go down here and it'll spin a lot faster.
Speed up.
So then you're doing cardio. Yeah, so then we have, you can also do some like plyometrics on here where you have people like holding on and just do some jumps. Stuff like that. So yeah, it's pretty cool.
It's really tightening up now. Cool. And then you just have different bikes and machines that...
Yeah, so we might warm some people on there, we might do some cardio.
Doing pedaling and arm work and stuff.
Yep.
And your typical weight machine here.
You got a TRX. So the other function of this wall is to have something to anchor to, so we have things that we can work on. We have TRX straps, we can do different workouts on here using your body weight. And then the TRX It's just like a elastic band, rubber band in there. And you just do different workouts on there. It's all anchored to the wall.
So like in a gym, people are using equipment like this to get in shape and strengthen their muscles, and kind of physical therapy is the same way, but for the purpose of healing.
Yep. It's all, we're going to be doing similar things and working with the same principles that a personal trainer might, but we just have a knowledge of, okay, this is how much you should be doing at this period of time with your injury and how much you should be doing, stuff like that.
Cool. Anything else cool in here you want to show us?
We have a ladder.
So when people have work injuries and stuff that they're like, I need to be able to go up and down a ladder, they can...
Yeah, so we can have them actually practice using the ladder, whereas a lot of therapy gyms don't have it. So that's the cool thing that we have here is that, like, someone who needs to get back to ladder climbing, you can get them on here, climb the ladder. You can have them go up to the top there, do some things, and come back down, go back and forth, because that's what they might be doing in their job. They might have them, work on this panel here, sticking pegs in there, pretending like you're screwing them in, and then go back up and do some more up there, different things like that.
So that, like, if somebody at work is doing those types of dexterous things, and they injure their wrists, part of their therapy is doing little things like that.
Yep.
All right.
Cool.
Anything else?
I think that's about it. Unless you want to know anything else.
I don't think so.
Okay.
Well, thank you, Dr. Sharman, for showing us
welcome.
around. If you guys ever get injured and are fixing your legs back up, you find a place with an Alter G. It's kind of cool. Anti-gravity. All right.